A routine daily shower can turn into a perilous situation for numerous seniors annually, with a particular time of day heightening the risk by more than 80%. Recently, a 75-year-old grandmother took what would be her final shower due to an unfortunate timing decision. Today, I will discuss the critical timing that may jeopardize your well-being and the straightforward changes that could protect it. This information is not merely beneficial, it could be crucial for you or a loved one's well-being. May I pose a question to you? Is the familiarity of your daily shower truly worth jeopardizing your well-being when a straightforward adjustment could significantly enhance your safety? The concealed risks associated with showering. The significance of timing may be greater than you realize. Have you ever experienced feelings of lightheadedness or dizziness during or after taking a shower? That fleeting vulnerability should not be overlooked. Your body is providing an important alert that should not be ignored. Many older adults may not be aware that their bodies function according to a natural circadian rhythm, which can lead to periods of increased vulnerability at various times during the day. At these particular moments, your blood pressure, body temperature regulation, and balance mechanisms are functioning at their lowest capacity, which can lead to an increased risk of accidents or even cardiovascular incidents while showering. It may surprise you to learn that the timing of your shower can significantly impact your health after the age of 70. The data presented is alarming and warrants the attention of all viewers at this moment. Research published in the Journal of the American Geriatric Society indicates that falls in the shower rank among the leading causes of fatal injuries in older adults, with specific times of day presenting a significantly higher risk, making certain hours up to 4 times more perilous than others. Their research indicated a concerning 78% rise in bathroom accidents during certain hours, attributed to natural fluctuations in blood pressure among individuals aged 65 and older. This is not a matter of mere coincidence. It is essential to recognize the consistent pattern that exists. The interplay of water, fluctuations in temperature, and specific times of day results in what experts in elderly care refer to as a critical situation for significant accidents. When hot water comes into contact with your skin, it triggers the rapid dilation of blood vessels, leading to a sudden decrease in blood pressure. During specific times of the day, your body naturally undergoes fluctuations in blood pressure, which could lead to significant consequences. Last year, there were more than 235,000 bathroom injuries that necessitated emergency treatment, with a significant number occurring during particular time frames. Isn't it valuable to comprehend these patterns if they could potentially preserve your well-being? If you have encountered any instances of dizziness during your shower, please indicate your response by typing "yes" in the comments section below. Your experience could assist another individual in identifying this important warning sign. The most perilous time to take a shower, hazards in the early morning, 4:47 a.m. Do you belong to the countless seniors who prefer to shower at the start of their day? This routine could potentially expose you to significant health risks. The early morning hours, especially between 4 o'clock and 7 a.m., pose a significantly increased risk for seniors during showering, with a danger level 4 times greater than at other times of the day. In the early hours, the body undergoes significant fluctuations in blood pressure, often reaching its lowest level within a 24-hour period. The combination of circulatory stress induced by a hot shower can lead to optimal conditions for strokes, fainting episodes, and cardiac events. Are you aware of the changes occurring in your blood pressure during the early morning hours? Researchers at Harvard Medical School found that between 4 and 7 a.m., older adults often undergo a phenomenon known as morning surge, characterized by a swift increase in blood pressure as the body readies itself for waking. This increase places significant strain on your cardiovascular system as it currently stands. However, when the temperature shock of transitioning from a warm bed to a hot shower occurs, the consequences can be severe. The abrupt shift in temperature compels your heart to exert more effort at a time when your body is particularly susceptible to cardiovascular incidents. The unfortunate incident referenced in our title pertains to a 75-year-old woman who was discovered unresponsive in her shower at 5:30 a.m. The medical examiner determined that the timing of her shower played a crucial role in her demise. The situation unfolded as an ideal convergence of circumstances. Dehydration occurring overnight due to a lack of water intake during sleep, coupled with early morning fluctuations in blood pressure, followed by the sudden temperature change from a hot shower. Research from the American Heart Association indicates that this combination can elevate stroke risk by as much as 70% in older adults. How many early morning showers have you taken without being aware of the potential risks involved? Is adhering to this routine truly worth the risk to your well-being on a daily basis? The second most perilous period occurs during the evening, specifically at 8:10 p.m. Do you administer any evening medications prior to your shower? This prevalent routine establishes an additional hazardous time frame for showering, specifically during the evening hours from 8 to 10 p.m. Numerous older adults use medications for blood pressure, heart conditions, or sleep in the evening, often unaware that these can greatly influence their balance, blood pressure, and alertness at the very moment they enter a slippery shower. The Centers for Disease Control has observed that incidents of falls in bathrooms are most prevalent during the evening, particularly among individuals aged 70 and older. Medication timing plays a crucial role. Have you observed the increased darkness in your bathroom during the evening hours, despite the lights being illuminated? This is not merely a figment of your imagination. The National Institute on Aging has observed that older adults need significantly more illumination to achieve clear vision in comparison to their younger counterparts. Evening lighting conditions present significant visibility challenges, resulting in a 65% increase in overall risk during evening showers. Even with the bathroom lights illuminated, the presence of shadows, glare on wet surfaces, and diminished contrast sensitivity significantly hampers the ability to recognize hazardous situations. Your visual perception may not be sufficiently rapid to identify potential dangers and avert mishaps. Evening fatigue constitutes a significant risk factor that many seniors often overlook. By the end of the day, your energy levels are diminished, your equilibrium systems are affected, and your response time is notably reduced. Should you happen to lose your footing in an evening shower, the body's mechanisms for self-correction and fall prevention are significantly impaired. Research conducted by Johns Hopkins University indicates that physical fatigue significantly diminishes a senior's capacity to recover from a slip, with a reduction of nearly 80% compared to earlier in the day. The interplay of diminished eyesight, the impact of medications, and overall physical exhaustion can lead to significant challenges. Is your evening shower routine truly justified given this level of risk? Physiological changes after the age of 70 that necessitate careful consideration of shower timing. Have you observed an increase in instability while showering as you age? This is not merely a matter of perception. It is grounded in actual physiological alterations that render the timing of showers progressively more important after the age of 70. The capacity of your body to manage temperature and blood pressure during activities such as showering significantly diminishes as one ages. According to findings published in a reputable medical journal, by the time one reaches the age of 70, the body experiences a significant decline, losing almost 60% of its ability to respond swiftly to variations in temperature. This indicates that elevated water temperatures elicit more intense reactions in your circulatory system at the very moments when stability is crucial. It is important to understand that by the age of 70, the body experiences a significant decline in its capacity to adjust to temperature fluctuations, losing approximately 60% of this ability. Upon entering a hot shower, the blood vessels close to your skin undergo rapid dilation to facilitate heat release. In younger individuals, the body responds immediately. However, in older adults, this compensation tends to be postponed and is often not fully realized. The outcome includes abrupt decreases in blood pressure, which may lead to symptoms such as dizziness, fainting, or potentially provoke cardiac incidents. Researchers focused on older adults at Mayo Clinic have discovered that immersion in hot water leads to blood pressure reductions that are 3 times more pronounced in seniors than in younger individuals. The timing of your shower can significantly enhance or reduce this effect. What factors contribute to the bathroom being statistically the most hazardous area in the home for older adults? This involves the integration of several high-risk factors. Slippery surfaces, rigid fixtures, limited spaces, temperature variations, and tasks that necessitate balance and coordination. According to the National Safety Council, a significant 80% of falls among seniors in the home take place in the bathroom, with the shower being the primary location for these occurrences. Your bathroom serves as a convergence of potential environmental risks that can significantly escalate during particularly sensitive periods of the day. Recognizing these risks can significantly enhance your safety. If you have encountered any near incidents in the shower, kindly share your experience by commenting with the phrase, "close call." Your experience could potentially be life-saving for another individual. The optimal time for bathing is during the midday window, specifically at 10 a.m. 1400 hours. Could merely adjusting the time you spend in the shower contribute to a longer lifespan? Geriatric specialists affirm that the answer is indeed yes. Studies indicate that taking a shower around midday, particularly between 10 a.m. and 2 p.m. significantly lowers cardiovascular risks by an impressive 73% when compared to showers taken in the early morning or evening. At this time of day, your body's ability to regulate temperature, maintain stable blood pressure, and achieve peak alertness is functioning at its best. This establishes the most secure physiological environment for the stress associated with showering activities. What factors would influence your decision to modify your schedule to shower during these safer hours? Take a moment to reflect on this significant evidence. Research from Harvard Medical School indicates that older adults who take showers around 10 a.m. and 2 p.m. experience a reduction of 64% in bathroom-related accidents when compared to individuals who shower during high-risk periods. At midday, your body has reached a state of full alertness following the morning variations in blood pressure, is adequately hydrated, and has not yet experienced the decline in coordination and awareness that typically occurs in the evening. Your cardiovascular system is functioning optimally precisely when it is most essential. Exposure to natural daylight during midday hours plays a crucial role in minimizing the risk of falls by enhancing visual clarity in the bathroom environment. Research conducted by the Vision Council of America indicates that natural daylight serves as the optimal lighting for older eyes, minimizing shadows and enhancing contrast sensitivity by as much as 300% in comparison to artificial lighting. This indicates that you will identify potential risks with greater ease and react with enhanced efficiency. The synergy of peak physical capability and favorable lighting conditions renders midday the unequivocally safest period for older adults to engage in showering activities. If you are showering during high-risk hours, would you contemplate making this straightforward yet potentially life-saving adjustment to your routine? Your choice may significantly influence your ability to sustain your autonomy in the future. Essential safety adjustments that extend beyond mere timing. Is your bathroom designed to promote safety or expose you to danger? In addition to timing, specific alterations to the bathroom environment can significantly decrease the likelihood of shower-related accidents, with research from the National Institute on Aging indicating a remarkable reduction of up to 87%. The three most essential safety enhancements include correctly installed grab bars, as towel racks may detach from walls, non-slip mats featuring drainage holes, and shower seats that facilitate bathing while seated. These straightforward adjustments convert a hazardous setting into a markedly safer one, irrespective of the time you choose to shower. How many of these straightforward adjustments have you implemented to safeguard your well-being? The temperature of water is an important safety consideration that many older adults often overlook. The ideal temperature range for a shower that reduces cardiovascular stress is between 98 to 100 degrees Fahrenheit, or 36.6 to 37.7 degrees Celsius. The American College of Cardiology indicates that temperatures exceeding 104 degrees and 40 degrees Celsius may lead to significant decreases in blood pressure among older adults. Utilizing a straightforward shower thermometer or a device designed to prevent water from reaching unsafe temperatures could significantly enhance your safety and well-being. The duration of your shower is equally important as the timing and temperature. Investigations conducted at Johns Hopkins University have revealed that showering for more than 10 minutes can notably elevate cardiovascular stress and the risk of falls among elderly individuals. Prolonged exposure to hot water can lead to the dilation of blood vessels, resulting in a decrease in blood pressure and potential issues with balance. The ideal duration for a shower, which effectively balances hygiene advantages with safety considerations for individuals over the age of 70, is between 5 to 8 minutes. This straightforward modification in timing may lower your likelihood of incidents related to showers by 33%, based on their findings. Take a moment right now to subscribe to our channel for more essential health information tailored specifically for seniors. Indicators that you may be showering at an inappropriate time. Have you noticed any of these warning signs and brushed them off as merely a part of aging? Particular signs occurring during or following a shower suggest that you may be facing an urgent health concern. Symptoms may encompass sensations of lightheadedness or dizziness during showering, episodes of blurred vision or visual disturbances, an increased heart rate or irregular heartbeats, sudden leg weakness, or the necessity to sit down during or right after showering. The Journal of Emergency Medicine indicates that 82% of seniors who encounter significant shower incidents noted at least one of these warning signs in the weeks leading up to the event. Will you choose to wait for a significant decline before taking action, or will you respond to these early indicators promptly? Incremental adjustments in shower comfort frequently occur before significant events. If you are experiencing heightened anxiety regarding your showering routine, feeling compelled to hurry through the process, or noticing an increased reliance on fixtures for support, it is essential to recognize that your body is conveying important signals that warrant attention. Research conducted by the Yale School of Medicine indicates that these nuanced behavioral changes typically manifest 3 to 6 months prior to a significant fall, providing an essential opportunity to implement preventive measures. This is a straightforward self-assessment designed to evaluate whether your existing shower routine may pose any risks to your well-being. Position your feet together, allow your arms to rest at your sides, and gently close your eyes for a duration of 30 seconds. It is advisable to perform this activity near a counter or wall to ensure safety. If you experience considerable swaying or find it necessary to open your eyes or seek support, it indicates that your balance system is impaired, thereby increasing the risks associated with showering significantly. Research published in the Journal of Gerontology indicates that this 30-second balance test can accurately predict the risk of falls in the shower with a remarkable 92% accuracy. Conducting this straightforward assessment on a monthly basis can assist you in tracking your risk level and implementing necessary changes prior to the onset of a crisis. If you have any concerns regarding the safety of your shower after viewing this video, please type "safer" in the comments, and we will provide you with further resources specifically suited to your needs. Adjusting the timing of your shower could significantly impact your well-being after the age of 70. The unfortunate incident involving that 75-year-old grandmother could have been entirely avoided with the knowledge you currently have. Your autonomy, well-being, and lifespan rely on minor yet essential modifications such as the timing of your showers. Modifications that are straightforward yet remarkably impactful. The decision is in your hands. Persist with potentially hazardous shower practices or implement this one straightforward modification that could extend your years of independent living. If you found this information beneficial, kindly press the subscribe button and activate the notification bell at this moment. Please indicate your commitment to enhancing the safety of your shower routine by typing "safer" in the comments starting today. Be sure to check out the video that YouTube suggests for you next. The information provided may be equally vital for your well-being and security as the insights you've gained today. Keep in mind that even minor adjustments can have a significant impact on well-being, and this particular adjustment could be the most crucial one you ever undertake.